Aid workers in Haiti are facing major challenges getting help to the areas that urgently need it. Washed out roads are preventing deliveries of food, water, and medicine. My next guest says the lack of accessibility makes the condition ripe for a widespread cholera outbreak. Dr. Vincent DeGennaro is the president of Innovating Health International, a nonprofit organization dedicated to treating chronic disease in Haiti. He joins me now by phone from Port-au-Prince. First of all, sir, thank you very much for joining us.
Thanks for having me.
I want to start by asking you about the conditions on the ground. We know that some of the remote areas are only accessible or have been accessible by helicopter. I gather you had a chance to survey the ground by helicopter. Can you paint a picture for us of what you saw?
Yeah, the hurricane hit really hard on the southwest coast, and there's two big cities that were hit hard, Lakai and Jeremy. They have been able to get a decent amount of aid there because of the roads and because they're big cities. At this point, where the trouble is the smaller towns that are all along the coast, where 100,000 people live, and they live in all these kind of small towns dotted throughout it. When we flew over with the helicopter on Thursday, we didn't really see any signs of life, unfortunately. Not many cars, motorcycles, cooking fires, laundry out. Very sparse. Now that people are starting to get in by road, they're reporting 50, 100, 200 deaths in certain of these communes, and absolutely already reporting cases of cholera.
Heartbreaking, as you say. So people are now just accessing these areas. I gather there are some areas that no one has been to yet. No one's had a chance to reach. Is that right?
There are some, unfortunately, yes. We are flying in on airplanes to a city called Dame-Marie with our partners at Hero, and we have a team there on the ground doing medical triage and treating patients. In those towns all along there, like I said, the cholera is popping up where we know there are people. We're sending a team of ours into Port-au-Prince today, where there were 55 confirmed cases of cholera as of Sunday. So I imagine that's gone up since then. I think the more we get into these areas, we're going to see the death toll from the hurricane having rising. I think it'll probably settle out at around 2,000. I think the official numbers are somewhere around 1,000 at this point, but it's hard to get in there and see and count and verify at this point, let alone get in there with medical crews and more importantly, water, food, and shelter. Because the sooner we can get in there with water, food, and shelter, the less of a humanitarian medical disaster we're going to have on our hands.
2,000. What a horrifying number that is to hear. Tell me about immediately what can be done, what your concerns are about the potential cholera epidemic, what can be done in terms of getting vaccines to those areas.
Yeah, I think vaccines are going to be more difficult. In the short run, what we're doing is chlorine tablets, bottled water, those kinds of measures, oral rehydration therapy for people who already have cholera, and IV fluids, intravenous fluids for people who are already infected. And so that's kind of what we're shipping in at this point. We sent one shipment into Dame-Marie this morning, and another one is going to Port-au-Prince, along with our medical teams. So it's a bit of prevention in terms of treating the water, and then also expecting to have large numbers of cases and being ready to treat them. Fortunately, cholera is relatively simple to treat once it's diagnosed and the patients are in a health center that can give them oral rehydration therapy or IV fluids. If those systems aren't set up, it can be deadly very rapidly within hours.
We're seeing images of some makeshift hospitals. I know have been very hard hit by this. What are you hearing in terms of the ability to treat people, some of whom we're reading some stories of people who've had to walk for hours and hours from a small community on a broken limb to try to get help at a hospital, and then when they get there, there's not much there, is there?
You know, I think it wildly varies depending on where they're going. But in a lot of these places, absolutely, it's really difficult to get to. In Dame-Marie, we have to fly in by airplane and then hike 15, 20 minutes down a mountain and then take an hour-long boat ride. And so imagine trying to ferry enough supplies in for all that. It's not easy. And so it's a logistical nightmare. These towns are all on the other side of a mountain range. It's basically beach, these towns, and then a mountain range. And that's one of the reasons they got hit so hard. It's also one of the reasons that they're so inaccessible. Mudslides and bridges collapsing have made them difficult to get to by ground. and just debris on the roads. And so that's starting to open up, but you have to get heavy machinery out there, and it's very difficult. You really almost couldn't have a worse situation in terms of the accessibility for the people, for these health services. And, some of the town I was in yesterday, the health clinic had collapsed completely. So the doctor there where we dropped off supplies was, treating people in their houses, going door to door, the old-fashioned way.
Doctor, we really appreciate your insight on this. As dire as the information is, so important to get your perspective on this with what you've been able to witness and to hear from your teams. We wish you and your team the best in this. Thank you.
Thank you for reporting on this, and let's keep it in the news so we can get these people some help.
Will do. Dr. Vincent De Gennaro is the president of Innovating Health International. That's a nonprofit organization dedicated to treating chronic disease in Haiti.